Can I have a question?
Yeah.
Have you seen recently, it's just been like in the last 2 months maybe, I've seen twice some reports about research that have been done with ecstasy and psilocybin. Have you seen that in the papers lately?
No, what was it about?
It was basically about, and I wish I knew the sources, but some legitimate research that was done using ecstasy and psilocybin with trauma patients and the good results that they were finding. And I was just thinking about the link of, you know, we're talking about this question about going into the negative experience and really penetrating it as a way of releasing it, versus somehow creating an atmosphere or another state in which to explore it as a method for healing it.
Yeah.
So,
no, I see the relation. Now, I haven't seen those research, but there's, for really the past, well, almost since they were introduced, and particularly there's we've seen this kind of research to various degrees, and there was an enormous amount of research done on these before they became illegal. That's what's so interesting. That's all kind of hidden out there, but it's an extraordinary fund. And it tells us sort of both positives and limitations to it. But part of the positives is just what you're suggesting, which is that you can get in certain states, and these can enormously facilitate getting in touch with some of these, the very difficult material. And part of what tends to happen, ecstasy in particular, I noticed that when ecstasy used to be over-the-counter drug, and then around 1983, 84, Congress and FDA moved to make it a scheduled substance, in other words, illegal. And I was really shocked. The psychiatrists and psychotherapists came out of the woodwork by the thousands to testify at Congress. And I thought, well, they never go out of their way to do something like this. What's going on? And they had been using it in psychotherapy because it was so effective in helping to lower the repression barrier and the resistance barrier. But at the same time, what they reported is that just taking it, in a sense, by itself, wasn't as effective as taking it when you can do therapeutic work with it. In a sense, that's sort of what we're saying, is that you can get into certain meditative states, and they're going to help, but not quite as good as being able to actually work very specific techniques of noticing what the other impulses are, learning to identify with them. And there's a very important concept, certainly in psychoanalysis, but most forms of dynamic therapy, which is that if you don't interpret or understand the resistance to the impulse, it'll tend to come back. So you can befriend an impulse, maybe in your boss, and you feel better for a week or two. But then you notice your spouse is an idiot. I mean, what on earth is that? You know? And then you befriend that, you know, and then it's an idiot, and so on. So there's analyzing the resistance has been a classic therapeutic technique, and it doesn't happen if you just do drugs, however useful they might be, or just do meditation, however useful that might be. But what last thing I would say is that I think this again is it's just really unfortunate that research on this has been demonized, because what we're really looking at, I think, is, you know, in just use a quadrant model. What happens is that if you induce brain states in the upper right, that they have a state of consciousness correlate in the upper left. And so there are several things we can do to bring about brain states. One is drugs. Drugs act immediately on the physical substrate of the brain. Another are brain-mind machines. And whenever you use those, they induce a state of consciousness, the corresponding state in the upper left. So that's important because on the one hand, we can use some of these more mechanical means, which I'm including a drug as a material thing, or a brain-mind machine as a material thing. And that can help with upper left states. But again, that kind of research is short-circuited as long as we really continue to demonize a lot of these things. And we understand why some of this happens, and society has a right to be a little bit questioning about these kinds of drugs if they're available to young kids and adolescents and stuff like that. But at the same time, you can really go overboard, and that's too bad. But that's the kind of research I think is absolutely fascinating.